Hi, I'm Dr. Edward R. Cusick. Thanks again for including us to be able to treat for your child, whether it's a baby or a toddler, or maybe it was yourself. We really appreciate having the confidence in us to being able to treat you. So I just wanted to go over some things. You know, the day that we do the procedure, it's kind of hectic and we're throwing a lot at you. So I just want to have this video so you can actually see what the things we were talking about during the day. So in the bag that you received, there's different things and a couple of brochures in there. One is called Tethered Oral Tissues Evaluation. Basically, this is like a pre-op diagnosis for you, telling you some of the myths and facts of tongue ties, and then basically some of the different types of ties that are present in there. So the one that's very difficult to diagnose is the posterior tie. And the one thing that's very helpful is symptoms that is discussed in there. So you can share that with one of your friends or so. The other one is very opportune for you is the post-operative brochure, and basically we went over all this with you, but in written form now you have that as a reference to go over how to do the stretches. So, and you also have another video that actually shows us doing the procedure. You have a groove director, a take-home groove director. It's a little different from the one that we were using, but this one helps immensely to do the procedures, the stretches. Once we've been having patients use that to do the stretches, decrease the amount of reattachments we had significantly. So very, very important. So, and it's very, very important to do the stretches. So again, 4 times a day for 4 weeks. We have gauze into the packet in case there may be some bleeding initially that happens, maybe the first day or so. One of the things too, and I discussed this on the post-operative, that when some of the scabs, that white patch starts to remove in there, it does maybe bleeds a little bit, so just don't be alarmed with that. Another thing, tea bag, it's not for your comfort, but in case there's some bleeding in the area, you can moisten the tea bag, and if it oozes quite a bit and the gauze pressure doesn't seem to stop it, moisten the tea bag, put pressure on it for, if you can, for at least about a minute, and that'll stop the bleeding right away. So just kind of a FYI for you, if when they get older and stuff, they cause a little bleeding, you can be able to stop that. For the older children, we have a thimble in there, and that's just, we put and we'll have some gloves in here too. So you put on your weak hand, so I'm right-handed, so I put it on my left hand and my first finger, put a glove over the top of that, and then use that as a mouth prop so the child won't bite you when they get their back teeth in that area. Another thing that you may see in the packet is there's a little form there, and one of the doctors, here's Dr. Haley, she actually likes to see children, and so it's kind of offering a way to do some exams after when they get about a year old. Other things we like to do is, we like to see a weight gain of about 4 to 6 ounces between the time that we did it and a week afterwards. So that's usually a good weight gain for you. Again, it's very important to do the stretches, and without doing the stretches, things will reattach, and everything's for naught. So again, thanks for allowing us to do the treatment on your child. We look forward to seeing you again for others, and thanks for referrals again into this office.